The morphology of lateral incisors refers to their structure and shape, which can vary slightly between individuals but generally follows a consistent pattern. Here's a detailed overview of the typical features of lateral incisors. Crown-shaped maxillary lateral incisors, upper jaw. The crown of the maxillary lateral incisor is usually more rounded and less symmetrical compared to the central incisors. It can be slightly tapered and may have a more pronounced curvature on the distal, toward the back of the mouth, side. The incisal edge is often slightly curved. Mandibular lateral incisors, lower jaw. These tend to be more symmetrical and have a straighter incisal edge compared to their maxillary counterparts. The crown is generally narrower than the maxillary lateral incisor and has a more rectangular shape. Size and proportions. Maxillary lateral incisors. These are slightly smaller than the central incisors but larger than the mandibular lateral incisors. They are generally more rounded. Mandibular lateral incisors. These are smaller than the maxillary lateral incisors and are more uniform in shape. Roots. Maxillary lateral incisors typically have a single, conical root. The root may have a slight curvature towards the distal side and can occasionally have a shallow groove or depression on the mesial, toward the front of the mouth, surface. Mandibular lateral incisors also generally have a single root, which is usually straighter and may be somewhat narrower compared to the maxillary lateral incisors. It might show a slight distal curvature. Incisal edge. Maxillary lateral incisors. The incisal edge often has a slight curve and may show some variation, including small developmental grooves or ridges. Mandibular lateral incisors. The incisal edge is typically straighter but can have a slight curve. There may be subtle developmental lines or ridges present. Root canals. Maxillary lateral incisors usually have a single root canal, though occasionally, there can be two canals or a second root. Mandibular lateral incisors usually have a single root canal, although some may have two canals. Additional features. Maxillary lateral incisors. The cingulum, a rounded elevation on the lingual surface near the gum line, is usually well developed and can sometimes have a deep fossa or pit. Mandibular lateral incisors. The cingulum is present but usually less pronounced than in the maxillary lateral incisors. The lingual surface is relatively flat. Overall, the lateral incisors play a critical role in both the function and aesthetics of the dentition, and their morphology is adapted to complement the central incisors and canines in the dental arch.